During pregnancy, your body undergoes a lot of changes and your body tries to adapt to the growing baby. And also, due to hormonal changes, all this might be accompanied with complaints. If you have complaints, make sure you speak to your healthcare provider in order to get the right information. Desist from seeking information from just anybody because pregnancy is a very delicate period and any misinformation can endanger you and your unborn child. You are welcome to my channel. How is the pregnancy journey going? I wish you a safe delivery. In this episode of Antenatal Health Talk, I'll be talking about the common complaints in pregnancy and how to handle them. But before we go there, if you've not subscribed to my channel, please subscribe and give this video a like. Let's get into the video. The first complaint I'll be talking about is the morning sickness. Morning sickness doesn't occur only in the morning, it can occur at any time of the day and it is characterized by nausea and vomiting. Morning sickness doesn't affect your growing baby except when it gets severe. And when it gets severe, it is known as hyperemesis. In this situation, most times women need to be hospitalized in order to get relief. And not all women experience morning sickness. Some people might not experience morning sickness throughout their pregnancy, but for some people it gets bad that they might need hospitalization. How to handle morning sickness? Number one is to take a lot of fluid. Take little fluid at a time. And number two, take fluids that you can tolerate and take it slowly in order not to trigger vomiting. And number three is to speak to your healthcare provider about it. Maybe there might be some medication that might help you get relief. Taste bud changes during pregnancy. During pregnancy, food might tend to taste differently and sometimes you need to avoid some certain food. This occurs as a result of hormonal changes. How do you handle this? First is to eat meals that you tolerate in order to meet with your nutritional needs. And secondly is to speak to your healthcare provider about it. Indigestion and heartburn. Indigestion and heartburn is very common during pregnancy. It can occur in early pregnancy and it can also occur in late pregnancy. But still not all women experience this. During early pregnancy, indigestion and heartburn might be caused by hormonal changes, and in late pregnancy, this is caused by the growing bump pressing on your stomach. Then how do you handle this? First is to eat small meals at a time. Secondly, don't rush your food. Thirdly, avoid hot food, avoid fried food, and avoid spicy food. And fourthly, make sure you speak to your healthcare provider about it. Sleeping. During pregnancy, it's very common that women may experience discomfort while lying down, or sleep might be altered by frequent urination, heartburn, or the baby's kick. How to handle this? Support yourself with pillows in order to attain a comfortable position. And secondly, you can try out the pregnancy pillows, which helps you to attain a very comfortable position while sleeping. Muscle cramp and backache. Women might experience muscle cramp and backache during pregnancy, which is caused by hormonal changes, and also the increasing weight of your growing baby might cause muscle cramps and backache. So how to handle it? First is to exercise moderately daily and also speak to your healthcare professional about it. Mood swings and emotional changes during pregnancy. It's very common that women might experience mood swings and emotional changes during pregnancy, as this occurs as a result of hormonal changes. How do you handle mood swing and emotional changes during pregnancy? Number one is to seek support from loved ones, and also if there are people that will be around you that makes you feel comfortable, be around those people. And number two is to use diversional therapy by reading books, by engaging yourself in activities so that you can get off it. And thirdly is to speak to your healthcare professional about it. Stretch mark and itching. During pregnancy, as your skin stretches, it might cause itching, and later there will be appearance of stretch marks. How to handle this is by applying oil over your body every day after having your bath. And if you want to avoid stretch marks on your abdomen, what you should do is after having your bath, apply shea butter or castor oil generously every day from the 4th month of your pregnancy until delivery, and by doing that, you will not have stretch marks on your abdomen. Constipation. Constipation is common in pregnancy, especially in the last phase of pregnancy. This is caused by hormonal changes and also your growing bone pressing on your digestive tract. How do you handle this? First is take a lot of water, and secondly, eat a lot of fruits and vegetables. Piles, which is also known as hemorrhoid occurs during pregnancy, mostly on the last phase of pregnancy. This is caused by increasing weight of your growing baby pressing on your rectum. This might make you feel uncomfortable going to the toilet. It can cause itching, it can cause pain, and sometimes it might be accompanied by bleeding while you use the toilet. How do you handle this? First is to take a lot of fluid. Secondly, eat a lot of fruits and vegetables. And thirdly, avoid straining when using the toilet. When you feel the need to strain, rather close your mouth and breathe in and out until you finish using the toilet. This will help to improve it. And lastly, speak to your healthcare provider about it so you can get the right treatment. Thank you for watching. I hope this video was helpful. If you've not watched the previous episode of my antenatal health talk, I'll be leaving the link in the description box. And don't forget to subscribe and tap on the notification bell so that you get notified when I post the next episode of my antenatal health talk, where I'll be talking about the danger signs in pregnancy.